Whenever you make changes, big or small, in your business or in life in general, it requires courage. Some of us don't like change, and even those who embrace it, still, it's just something new and different to accept and adjust to. I understand. The changes that are coming up on the podcast are great. And I'm real excited about all of this because I know these changes will make such a positive difference in our community as we continue to move forward and grow. You're listening to the PHEC podcast, episode 208. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Huntley, and I'm your podcast host. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. I'm going to take just a few moments to explain some of the changes that are coming up very soon here on the podcast and in our community overall. Now, if you have not listened to episode 207, please make sure that you take a moment or two to listen to that. It's also a short and brief, to the point episode, but you've got to check it out. I will tell you right now that I am re-recording this particular episode because it's important to me that I share in real time with you the changes as they're happening. So as soon as episode 207 was released, I was flooded with comments and questions. Well, not really so many questions as comments and feedback. I received several emails and messages across social media, but some of the emails that I received not only confirmed what I already knew and what I already been realizing in the community around the challenges that I spoke of in the last episode, but some of the stories that people shared with me, people really began to open up and become a bit vulnerable and share some of their personal experiences with the challenges that I talked about in the last episode. And that, I just want you all to know, was so encouraging for me because, as you see from the title of this episode, The Courage to Change, it takes courage to make big changes. And although I was ready to do it, ready to move forward, some of the changes that I'm making are big, significant changes. And I realized that some people just don't like change, while others are excited and thrilled and embracing the change. Those of you that have been following me in my community and following this podcast for a while, you're going to notice a shift. You've probably already noticed it in the way I raise some of these topics when I talk about these particular challenges, especially if you follow my LinkedIn lives. I'm really passionate about really how we shift the atmosphere as public health professionals. So I'm excited about these changes because I know it's going to empower all of you in so many different ways, whether you're a student, whether you've already graduated, whether you're new in the career, and so many of you who are seasoned and more senior in your career in public health have reached out to let me know how much these challenges have impacted you, these challenges that I spoke about in the last episode. And that reassures me, of course, further confirmation that the changes that I'm making are what is needed, but also lets me know that the problems, the challenges, and the issues have a broader reach than I even thought, are impacting more and more people that I didn't realize. So I'm really just wanting to let you know that I appreciate all of the feedback, every last one of you that reached out to me, even if I could not respond or did not respond to all of the emails or messages. Just know that I did receive them. They all made their way to me, and that I really appreciate you being vulnerable and opening up and just reaching out to me. I really, really appreciate that. So that fuels my energy as I share with you, as promised, the changes that are coming up. So I'm not going to take a long time, but I do want to touch on those because the very next episode is sort of the unveiling, as you will. So if you're keeping up with these episodes and you're listening on the day that this is released, exactly a week from today, in the very next episode is when everything goes live. So I'm excited, and I think a lot of you are really excited as well. So like I said, in the previous episode, episode 207, I talked about the challenges we face as a community of public health professionals. Again, if you did not hear that episode, please be sure to listen to it. It's short and sweet, but packed with foundational tidbits and really thought-provoking message. So in this episode, I'd like to take just a moment or two, explain some of the main changes that are coming up and how we will move forward. One of the goals of this podcast is to help my audience think outside of the box regarding public health, the broad field of public health and the unlimited potential to see public health everywhere and to connect with many other industries. So I've always had diverse guests from various areas of public health on this podcast. And now I will be bringing even more guests from other industries and connecting public health during our conversations. So my questions to my guests will be designed to generate conversations about public health in these other industries. Our conversations will be geared around or maybe toward inspiring you to think beyond job titles and really open your mind to seeing public health opportunities in any job. So that is really where I want you to go. I want you to move away from just thinking about the job titles, but thinking much more broadly, regardless of the title, but just really being able to see public health opportunities in any job. Our conversations will also be geared toward inspiring you to connect the dots for yourself and to be able to discuss how you are applying public health principles in your role, regardless of your title. These conversations on the podcast will help you open your eyes wider and see how you are doing public health outside of the health department and research institutions and outside of traditional roles. And even when your title doesn't say epidemiologist or community health education or educator, for example, really just being able to see public health in anything that you're doing. I'll give you a hint. There will be a slight change of the title of the podcast as well. And that's designed to better reflect what I've just described. That change will be announced next week and made official on the very next episode. Now, another goal of the podcast will be to include other industries in our public health conversations because others are curious. Other people in different industries are really curious about public health and they're interested, and so much can be gained through these conversations. Really good conversations often lead to inspired actions that can further lead to greater positive impact. And, when this happens, we all win, right? I'm very passionate about this. So another goal will be to help you see and understand the importance of epidemiology as the foundation of public health. So understanding this in an applied way to other industries can be very powerful. Not just eye-opening for you as a practitioner, but it can fuel the work you do and help you have a greater positive impact on communities that you serve. Epidemiology has always been in the center of this podcast title, but not because my podcast interviews are just for people who want to be epidemiologists. Although I've had, several interviews with some great epidemiologists, but the title, it's been a center of the title because I wanted everyone to embrace epidemiology in every part of public health. So moving forward, on this podcast, we will do this more directly by including the importance of epidemiology and connection to various industries in our conversations on these episodes. Over time, as you continue to listen, you'll begin to see public health in more places and begin to see the application of epidemiology as well. Really excited about that. Really excited about that. That's challenging me as a podcaster. It's challenging me as a practitioner, and it's helping me to reach and stretch a little bit more in ways to help my broader community because I just care that much. It's that important. So in addition to what I've just described, we've got some branding changes. So our logo will also change, as well as the colors and business mission, our vision and value statements. All of that's gotten an upgrade, I guess, for lack of a better phrase. These branding changes are all intentional, nothing random. And they are a result of careful thought and consideration to align with clear focus and direction that I want to lead our community in. All of these changes will become active on August 17th of 2021 and will be announced on the next podcast episode, which will be episode 209. And all of those changes will be published on that day, the same time the episode goes live. So everything happens that day. Give or take a few hours. Grant me a little grace, and it doesn't always align up perfectly, but give or take on that throughout that day. So moving forward, as you can tell, I am very excited about these changes because I know it will make such a positive difference in our community as we continue to move forward and grow. Join me on the next episode where I will announce the new podcast title and reveal all of the branding changes as well. It's going to be incredible. I've taken this intentional, deliberate time to explain these things to you as a community. And as we slightly pivot, I didn't want to make a sharp turn, but more of a pivot in a different direction. But everyone will win. The way I see it, there's no losing here, but there's some things needed to change. So be sure to subscribe to the podcast, or I should say follow the podcast on all apps, but subscribe to the website so that we can reach out to you through email and notify you as soon as the next episode is released so that you can be among the first to hear the latest episodes. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Careers Podcast. Visit drchuntley.com to find the show notes page for each episode and to learn how to work with me.